Okay, so now we're continuing with the next part of pelvis. So we're going to be covering the pelvic organs. And the pelvic organs, we will start with the rectum. And as I said, I'm only going to be highlighting the most important part of each um pelvic organ. So we're just going to be covering the thing that's like super important, and we're leaving the rest out because we don't really have the time. Maybe next time I might make a video or something that's more detailed, but for now we're just going to be discussing أهم حاجة في كل organ. تمام. So الريكتم الحاجة اللي بتهمنا فيه هو البلد سبلاي والفينس drainage. أكتر حاجة مهمة في الريكتم. تمام. So البلد سبلاي والفينس drainage حق الريكتم. البلد supply is by three arteries: superior rectal artery, middle rectal artery, inferior rectal artery. تمام. يلا superior rectal artery دي it's a continuation or a direct continuation of an inferior mesenteric artery. تمام. يعني inferior mesenteric artery دي direct continuation ليها بتدينا superior rectal artery. تمام. يعني هي it's an abdominal artery, it's not a pelvic artery. while الميدل والinferior هما بيجين من البلفس. الميدل rectal artery بيجينا من branch of anterior internal iliac artery. So middle rectal من internal iliac. والinferior rectal بيجينا as a branch of internal pudendal artery. تمام. يلا الارتريز ذاتهم والبرانشنج حقه we'll discuss it later in the video. هيكون في details عن الارتريز ذات نفسهم كل واحدة جاية من شنو. تمام. يلا الفينس drainage ده بيهمنا في حاجة، بيهمنا إنه as you can see the superior rectal vein دي part of the inferior mesenteric, which means it drains into the portal vein. However the middle rectal والinferior rectal they drain into the internal iliac or internal pudendal, which makes them systemic veins. تمام. يعني معناتها إنه venous drainage of the rectum forms an area of a portosystemic anastomosis or a portosystemic shunt. تمام. So because إحنا عندنا في حتة الركتم دي portosystemic anastomosis معناته في حالة portal hypertension بيحصل لنا backflow of the blood from the portal to the systemic, and in that area it would result in dilation of the veins. والvein dilation ده بيدينا important clinical correlation which is rectal hemorrhoids. And the rectal hemorrhoids then بيكون بيجي symptoms mostly as a sign of rectal bleeding. تمام. So بيكون في bleeding. So again, to just really go through this again really quickly, a venous drainage of the rectum is by three veins: a superior rectal vein, which is part of the inferior mesenteric vein. So it's a portal vein, eventually drains into a portal vein. تمام. وعندنا middle rectal vein والinferior rectal vein, which drain into internal iliac or internal pudendal, which makes it a systemic vein. فمعناتها الrectum is an area of portosystemic anastomosis. وبما إنه هو area of portosystemic anastomosis معناتها it will result in vein dilation in cases of portal hypertension. وبعد ذاك يدينا rectal hemorrhoids. If you want to know more details about a portal hypertension, there's a video about it في abdomen, the last video. تمام. So ده كده in summary what is really important about the rectum اللي هو blood supply والvenous drainage حقه. طيب next عندنا البلادر. البلادر فيها two important things you need to know, which are أول واحدة هي إنه there is an area of the bladder called the trigon, and it's very important to know what the trigon is. And يلا الtrigon هي عبارة عن area which is not full of mucosal folds, so it's not the same as the rest of the epithelium حق bladder. So as you can see a trigon here, it's very smooth, it's not smooth walled ما زي الباقي which is full of folds, filled with folds. الحاجات المهمة إنه to know which what is the boundaries of the trigon, or like where it is. وهي it's exactly between the ureters, so an area between two ureters هي بتصنع لنا البيس حق الترايجون. تمام. دي أول حاجة. ثاني حاجة you need to know is the name of the muscles, the smooth muscles of the bladder. So the bladder itself, the smooth muscles حقتها اسمها detrusor muscles. يعني detrusor muscles هم المسلز حقت البلادر. These are things I would like prefer that you guys definitely know about the bladder. Next is the prostate. The prostate برضه I'm not gonna say much about it except for its blood supply, and specifically إنه blood supply حق prostate بيجينا من the inferior vesicle artery. Why? Because it's an artery that's supplying the bottom of the bladder معاها prostate. So prostate بيشيل blood supply من inferior vesicle artery, and تمام. So inferior vesical artery in males بتدينا البروستات blood supply prostate gland. تمام. So quickly again going through the things I just mentioned. عندنا البلادر فيها a trigon which is an area with no mucosal folds. Usually trigon they label it في الدي ار برضه، يعني كنا عاملين label للموديل حق البلادر في الترايجون specifically. إنه اسم المسلز السموث مسلز اللي في البلادر اسمهم detrusor muscles. إنه البروستات البلد supply حقه from an inferior vesical artery. So this is actually a very common question في الامتحان, like the blood supply of the prostate. Or like برضه في الدي ار sometimes they would like um, label the prostate and then ask you what its blood supply is. So it's important to know in the blood supply has the prostate, inferior vesical artery. تمام. Next عندنا اليوترس. اليوترس. What's important about the uterus are a few things. One, I wrote it last, but it's very important, is the position of the uterus. So the position of the uterus is situated in an anteverted, anti-flexed position. I'll show you guys a picture in a bit to explain to you what that means. عندنا تاني ligaments of the uterus, they're very important to know. Two most important ligaments to know about the uterus are the broad ligament of the uterus or round ligament of the uterus. تمام. البرود ligament of the uterus هي الهنا دي, as you can see, this whole thing is the broad ligament. So it's a really big ligament and it contains the fallopian tube. يعني fallopian tube is actually inside the broad ligament. دي كلها البرود ligament. تمام. في تاني a round ligament, and the one reason why the round ligament is very important is that it is one of the structures that goes through the inguinal canal in female. So you know that a round ligament of the uterus would pass through the inguinal canal. So it's important to know what the round ligament is. تمام. So two most important things about the ligaments, a broad ligament or round ligament. تاني في one more thing that's important clinically is that the ureter في الحتة دي في الاريا دي اليوريتر بيجي ماشي تيجي ماشي اليوتراين artery. Important to know that the ureter passes below the uterine artery. تمام. يعني اليوريتر هو below the uterine artery. And one of the ways where people usually remember it is they use this mnemonic that goes like water under the bridge, which means إنه اليوريتر, which is the one that's carrying the water or the fluid, is the or the urine is the one that's going under the uterine artery, which is the bridge in this mnemonic or analogy. تمام. يعني اليوريتر بيمشي below اليوتراين artery. دي حاجة برضه is very important, like they mention it a lot, لأنه in surgeries it's important to know يعني اليوريتر واليوتراين artery بيشبهوا بعض شديدا. You're supposed to ligate the artery, not the ureter. تمام. يعني when you're in surgery you're supposed to ligate the ureter من الارتري من اليوريتر. And sometimes it would be a very common mistake to mix up between the two. So to know them, you always know that the ureter is the one that's below. تمام. طيب. Let's repeat again. عندنا broad ligament, round ligament. البرود ligament فيها fallopian tube. Round ligament فيها it goes through the inguinal canal to the insert outside in the external genitalia. And في ureter passes below the uterine artery. The important يعني location. آخر حاجة هنا the position of the uterus, which is we said إنه it's anteverted, anteflexed. What does that mean? Let's take a look at it right now. So this over here is a diagram of the pelvis, female pelvis, and we're going to be looking at what the uterus looks like. So as you can see, this is the uterus, and it looks like that. And this is basically a position حقه ده الشكل ده is what it means when it says it's anteverted, anteflexed. يعني it is everted to the front. It's also flexed to the front. So it's كده وكده. So it's anteverted, anteflexed. That's the position of the uterus. It's very important to know. It's very common area of questions to ask you what the position of the uterus is. So yeah, كده احنا بنبقى عملنا الuterus, which is basically the position حقتها is anteverted, anteflexed. تمام. Next عندنا we're just going to be really quickly going through a diagrams of what the pelvis looks like from the side. تمام. Why? Because there's also it's very common for الامتحانات that the DR is to just ask you to label one of the organs and you just should know which one is which. So I'll just easily list إنه دي البلادر. يحتل البلادر طوالي في prostate, behind it في rectum, and in front right here there's the penis and the testis. تمام. يلا, one more important thing to know is that الperitoneum always reflects above the bladder, sorry. So a peritoneum would be going here, like that. Let go up. Come on. And because this happens here, it leaves us reflections, areas which are reflections of the peritoneum, which we call pouches. Come on. So this area here is known as the recto vesicle pouch. تمام يلا recto vesicle pouch is just for just knowledge purposes. You should know it. يعني ما فيه كلام كتير. لكن you need to know إنه في a recto vesicle pouch that which is found located in this area, right between right between the bladder and the rectum. تمام. نجي للفيميل. So في الفيميل عندنا البلادر عندنا الركتم، لكن between them there's the uterus، في الأوفري here وفي الفاجينا. تمام. Now the important thing about it is also to remember إنه في peritoneum which is reflecting, right? So the peritoneum is also reflecting here and here in two areas instead. So because it's reflecting in two areas, we end up with two pouches. We end up with the utero-vesical pouch, which is between the uterus and the bladder, and we end up with the recto-uterine pouch. And this one's very important. So the recto-uterine pouch is super important for two purposes. The first purpose is that it has another name. So its other name is pouch of Douglas. And the second thing about it is that is a very common area of extrauterine or ectopic pregnancy. يعني sometimes when the egg is trying to implant in the uterus, it accidentally goes outside and it implants here in the pouch of Douglas or the recto-uterine pouch. فعشان كده recto-uterine pouch, it's important to know two things about it. Is that its other name is pouch of Douglas, and that it is a common area of extrauterine or ectopic pregnancy. It's not the most common. The most common is in the fallopian tube. So the most common area of implantation extrauterine or ectopic is the fallopian tube. لكن بعديها is the pouch of Douglas, which is also known as the recto-uterine pouch, which is a pouch of peritoneum between the uterus and the rectum. Repeat that again. In the two pouches in female, which is one is between the uterus and the bladder, called the uterovesical pouch, and one between the rectum and the uterus, called the recto-uterine pouch. The recto-uterine pouch has another name, which is pouch of Douglas, and it's also clinically important because it's an area of extrauterine or ectopic pregnancy. تمام? Very important thing to know. It's very common that you would find it labeled in an exam or you'd be asked about it. Right. Next, we'll be talking about the blood supply of the pelvis in general. And the blood supply of the pelvis is mainly by the internal iliac artery. Okay? So the internal iliac artery is responsible for the blood supply of the pelvis. The internal iliac artery ذاتها is divided again into two. So it's divided into an anterior division and a posterior division. Posterior division has only three branches, which are the iliolumbar artery, lateral sacral artery, superior gluteal artery. تمام? What we're more concerned with is the anterior division. The anterior division, it gives supply to شنو؟ تدينا umbilical artery. umbilical artery دي ذاتها تتقسم لاثنين زيادة. يعني تدينا اثنين زيادة، تدينا artery to vase deferens in the male وتدينا superior vesical artery. تمام؟ while the umbilical artery itself ذاتها فيها extra part that's a remnant، يعني فيها part that's useless because it's no longer needed after الامبريو. يعني في جزء من الumbilical artery becomes a remnant و it's just the ligament. تمام؟ وفي جزء تحت الباقي becomes the artery to vas deferens والsuperior vesical artery. تمام. تاني عندنا anterior division بتدينا برضو obturator artery. So it's the artery that's going to supply the obturator muscles. في inferior vesical artery which we already mentioned جبال إنها it supplies the prostate, remember? So the inferior vesicle artery is going to supply the prostate in males. عندنا تاني middle rectal artery. عندنا internal pudendal artery, which was going to give us the inferior rectal artery, right? تاني في inferior gluteal artery, في uterine artery في الفيميل, vaginal artery في الفيميل. تمام؟ يعني again, let's go through them really quickly. In an anterior division, تدينا umbilical artery, which gives us the artery to vas deferens, superior vesical artery or vesicle artery. In the anterior division تاني بيدينا obturator و inferior vesicle, which gives us which supplies the prostate. In the middle rectal, which is going to supply the rectum. Internal pudendal artery, which will basically supply the perineum, plus معاه the lower part of the rectum. So تمام. في تاني inferior gluteal artery, في the uterine artery وال vaginal artery. Now, one thing that's very important to note here is that we did not mention testicular artery or an ovarian artery, okay? Why did we not mention an ovarian with testicular artery? It's because they are from the abdominal aorta. تمام؟ يعني one of the trickiest questions that we'd ask you usually is that which of the following is not a branch of the internal iliac, and they would mention a testicular or ovarian. You need to remember that the testicular artery or the ovarian artery, also known as the gonadal artery, are not branches of the internal iliac. Although they supply the pelvic organs, they are completely من abdominal aorta. تمام? So they're not part of the internal iliac. They are branching from the abdominal aorta. One of the most important things, and make sure you pay attention, because sometimes people just read testicular and they think, oh yeah, internal iliac. Okay? But it's not correct. Testicular ovarian are from the abdominal aorta. Okay, so last thing we're going to be talking about today is the lumbosacral plexus. And we'll be basically discussing the most important nerves. Lumbosacral plexus بيجي منها جزء من lumbar plexus, and most of it is from the sacral plexus. The part that comes from the lumbar plexus is specifically a lumbosacral trunk. When we were talking about the lumbar plexus last time, we mentioned إنه lumbar plexus آخر حاجة فيها lumbosacral trunk, and we didn't talk about it. So a lumbosacral trunk بيمشي من lumbar plexus للsacral plexus, okay? It joins with it a sacral rami of S1 to S4, وكده كلهم together they form the lumbosacral plexus. تمام؟ So the lumbosacral plexus فيه these nerves, and there are a lot of them, I know, but the most important one, and the one that I would say you have to memorize, is the pudendal nerve, which is S2, S3, S4. دي أهم واحدة. البقيات you can try your best يعني. And yeah, so I'm in the nerve to piriformis, which is S1 and S2, so it supplies piriformis muscle. The perforating cutaneous nerve, which is S2 and S3. The posterior femoral cutaneous nerve, S1, S2, S3. The pelvic splanchnic nerves, which are S2, S3, S4. The pudendal nerve, which is the very important one, here S2, S3, S4, and its function is that it supplies the perineum. تمام؟ تاني عندنا a nerve to quadratus femoris, which is L4, L5, S1, and you'll see this is where the lumbar part joins. See? So it's now lumbosacral. في أجزاء lumbar في أجزاء sacral, and these nerves are usually the ones that go to the lower limb. في يعني nerve to quadratus femoris, L4, L5, S1. في a nerve to obturator internus, L5, S1, S2. Superior gluteal nerve, L4, L5, S1. Inferior gluteal nerve, L5, S1, S2. The sciatic nerve, which is L4 لحد S3. تمام? Sciatic nerve is also very important to remember, but يعني again, as I said last time, you're going to be memorizing again anyway when it comes to lower limb. So في pelvis أهم حاجة هي pudendal nerve. ممكن برضه nerve to piriformis would be important. The pelvic splanchnic are also important. تمام؟ فده كده النيرف حد في lumbosacral plexus. We're just looking at another diagram of it. So we're looking at the lumbar ones and the sacral ones, and then joining together to form trunks. عندنا superior gluteal, inferior gluteal, piriformis muscle, a sciatic nerve, and as you can see the sciatic nerve is always the biggest one. The sciatic nerve ذاتها فيها tibial part and common fibular part, and in the lower limb it splits into two. So it splits into tibial and common fibular parts. تمام؟ في rest of the muscles that are all part of the sacral plexus. في pudendal nerve هنا, which is basically formed of S2, S3 and S4. and دي أهم واحدة obviously. في تاني الcoccygeal plexus, which is basically the nerves that are supplying the levator ani, coccygeus muscle, external anal sphincter muscles. So it's basically from S5 و S4 ديل معاها الcoccygeus pipe. تمام؟ So ديل كده بنسميهم الcoccygeal plexus. So sometimes it's the pelvic floor, pelvic floor. So it's elevator ani, coccygeus, والexternal anal sphincter muscles بيجوا من anal coccygeal nerves والcoccygeal plexus. تمام. This is pretty much the entire idea of the lumbosacral plexus. لكن زي ما قلنا أهم حاجة عندنا لا هي الpudendal nerve, which is the main nerve to the perineum.